All searching for the fountain of youth, aren't we? And some pretty good science is helping people find it. Goes by the name of Botox, Juvederm, Restylane. In 2012, nearly 1 million people in the U.S. used injectables and fillers, most of them women, and they are becoming more affordable.
More available, too, even online, and they're falling into the wrong hands. Consumer reporter Kristen Miranda investigates the price we pay to look good and why some are going blind for beauty.
3 women, 3 nightmare stories of fillers gone wrong. Melissa Pollock wanted to fill out her smile lines before she turned 50.
Ended up with an entire liquid facelift. It was scary. And I thought, oh my gosh, what have I done?
She had an allergic reaction to what she called a cocktail of 3 fillers that made her feel her face would break open. 14 years ago, Betty Roseman had some of her own fat injected in her cheeks.
It was until the right side of my face, where the fat injection started to fall down, that it became obvious that, hey, there's something the matter with the fat injections.
Doctors diagnosed her with everything from lupus to cancer before everyone realized.
How you doing?
And Leah Brim can't stand looking in the mirror. After getting bad silicone injections in her eye, cheeks, lips, at what's known as a plumper party in someone's living room, what the doctor calls an unsterile environment.
They inject silicone and also Botox. They do surgical procedures for real cheap.
Dr. Gilly Munavali with Dermatology, Laser, and Vein Specialists of the Carolinas says these parties happen every day in Charlotte.
Hopefully it's a legitimate product. In some cases it's not.
And when it's not, it's a very dangerous situation.
When it's not, you run into situations like we saw.
And rarely, he says, is a doctor giving these home injections. In the worst case scenarios like Lia's, they are not medical professionals at all.
It was just a mistake that I definitely regret.
When we're doing injections around the eye, I personally would rather have a skilled, experienced physician injector to do the treatment.
This picture shows why. Look at all of the arteries, veins, blood vessels around the eye. It is rare, but in the past 6 months, Dr. Munavali says
there have been multiple reported cases of blindness occurring, and these have been reported with filler injections in certain parts of the face, around the nose, in the brow area.
Is that blindness reversible?
It's not.
All 3 women came to this doctor to fix what others did wrong. Betty's having some luck with the laser treatments that he's giving her.
This has been reduced 30%.
They shared their stories to help others.
I'm all for to each their own. Just please do your research.
Because no line or wrinkle is worth the risk of this. Kristen Miranda, WBTV, on your side.
The doctor says the American Society for Dermatologic Surgery has guidelines your physician should follow. So ask them. Ask to make sure. Be sure he or she not only explains the complications that can arise with the use of fillers, but also how to reverse them. If they don't ask you to sign a consent form, that is a red flag. To see more photos of what can go wrong, head to our website, WBTV.com right now.